and we heard time and time again for people who were in survivorship that they felt like people did not prioritize their fertility, that they were not really adequately educated about their fertility, that they got to survivorship without knowing that the treatment they had gone through significantly impacted their fertility. And that is heartbreaking, and it's not fair. They deserve that. Actually, we're the only comprehensive fertility program in the state of Michigan, which means that we offer every potential option for fertility preservation for our patients. So we offer egg freezing, so if it's possible. It's not always possible. Sometimes people have a diagnosis that means that they need to start on their treatment right away. So their safety then is prioritized. If it's possible for them to go to a fertility center and freeze eggs, we try and do that. We do sperm banking for men. And then if they need to start their treatment, we can then come back around and talk to them about things like ovarian tissue cryopreservation and testicular tissue cryopreservation, where we take actual tissue and we send it to the University of Pittsburgh and they freeze it for the future use of that patient. For ovaries, this is not experimental anymore. It's really miraculous what they are able to do. They can take that ovarian tissue and graft it back onto the existing ovary that that patient has. And then that tissue hopefully will start to behave like normal ovarian tissue, and they will be able to have a biological child that way. And then with testicular tissue, that is still covered under research. That's still part of our research protocol, but they're getting there. And then there's also other things, like we can do our very best to protect people's ovaries or testes by protecting them from radiation if they need radiation oncology, or getting them medications that could potentially be protective for their ovaries. So we have a lot of different options here, and we try to counsel people through all of those options very early on so that they can make choices.